The managing of neuromyelitis optic spectrum disorder, and this is going to be by Dr. David Gu. Please make him feel welcome. Bienvenue, monsieur.
Hello everybody.
PowerPoint.
It is a pleasure for me to talk about neuromyelitis optical disorders in sub-Saharan Africa. In introduction, neuromyelitis optical spectrum disorder is a rare human disorders of cerebral nervous system, typically characterized by recurrent episodes of optical neuritis, longitudinal extensive transverse myelitis, and IRA post-senile syndrome. The 2015 revised international consensus criteria, the diagnosis of neuromyelitis spectrum disorder on the presence of core clinical characteristics and serum accompanying CAT autoantibodies. Previous studies on the incidence and prevalence of NMO symptom disorders have demonstrated ethnic difference in NMO with higher weight in no-Caucasian population than in Caucasian population. In 1971, in Nigeria, a single study in hospital of Ibadan reported 95 cases of NMO over 12 years of hospitalization admission. The earliest documented case in Africa was reported in South Africa by If and Modley in 1973. The majority of cases reported in Africa come from North Africa. Few cases from Sub-Saharan Africa with case reports and systematic review. And this is a systematic review with the study of Professor Kisani and in other studies and for the current state of diagnosis of neuroimmunological disorders in Africa and another 4 studies in epidemiologic studies in Africa. The prevalence of NMO in Sub-Saharan Africa, we see that the high prevalence was in Nigeria and the medium prevalence in Ethiopia. And numbers of cases were reported by Professor Kisani in 2022. And the case of South Africa represent 33%. Both the studies was, the majority of studies were retrospective and hospitalized by studies. The number of cases in Nigeria, we have 95 cases, and in Uganda, 1 case. You can say that 60 countries have 1 cases. In the studies of Muzubire, this is a review of 19 records between 1971 to 2020 with 410 cases. West Africa cases from Senegal, Niger, and Nigeria with 120 cases. South Africa with 5 studies with 59 cases, and East Africa with 2 studies from Sudan and Ethiopia with 35 cases. And if you see the region of Africa, first to have most of cases, and followed by South Africa and East Africa. Central Africa are less cases. I don't know, perhaps there are no epidemiological studies in Central Africa. And the number of new cases are well reported. I saw that in Ghana, between 2022 and 2024, there are 7 cases. And in the studies of Kisani, there are 1 cases. In Mali, between 2014 and 2019, 20 cases. And the most cases was reported in South Africa with 39 cases. In Nigeria, since 1971, we are not epidemiological studies here. We are reporting 2 studies in Nigeria after 1971. And the number of new case reported was 103 cases. According to gender distribution, you can see that we have a predominance of female gender. It is really in everywhere in South Africa. Women was most affected with NMO with 82%. According of gender distribution, you see that everywhere in Ivory Coast, always case is women, and Nigeria 78. According to the age distribution, the mean age of patient at diagnosis was 23 years. East Africa 28, West Africa 34, and South Africa 2028. Burkina Faso, we have a case in children, 1 case, with 6 years in Senegal, 3 cases, with 7 female patients, with mean age of 35 years. Latest onset after 50 years is frequent in Nigeria, in Cote d'Ivoire, Ivory Coast. And the current state of diagnostic, it is a report of studies in Africa who include most nurses, neurologists, gastroenterologists, nurses, and plenty of general practitioners. You see that we have the diagnostic suspected NMO is between 1 and 5 cases in the past year of the studies, and most of confirmed NMO disorder is not enough. This is the clinical characteristics of NMO in sub-Saharan Africa. We see optic neuritis is the first, and transverse myelitis. We have Ayla-Porcena syndrome, symptomatic cerebral syndrome with typical brain lesion, and symptomatic narcolepsy or acute diencephalic clinical syndrome. Ayla-Porcena, we have a few cases, 3 cases adults in Cote d'Ivoire, Nigeria, and Togo, 4 cases in Senegal. Cognitive disorders, we have depression and confusional syndrome. Access to MRI diagnosis, you see that in Burkina Faso, we have 6 MRI, and the cost in dollar is $80 for MRI cerebral and MRI spine cost. And the high cost is in South Africa. For the availability of immunoglobulin, aquaporin antibodies, autoantibodies, most of the country. In the 11 country, the serum autoantibodies were available, and not available in 10 countries, and not applicable in 10 countries. And so in some cases, the diagnosis you can do the diagnosis outside the country, outside. And the number of positive cases in Mali, we have 16 cases with 80%, Senegal 30%, Togo 83%, Sudan 74%, and Ethiopia 8%. Other investigation in animal disorder, we have a visual evocative potential is most due in Africa. It is most severe visual impairment than in multiple sclerosis. We have a cerebral spinal fluid analysis. The comorbidities, the first is HIV positive patient, and the second is TB, tuberculosis, and neurosyphilis, and neurasthenia. The treatment of animal disorder, we have high dose corticosteroids, methylprednisolone, and plasmapheresis and immunoglobulin. You see that in Africa, the most treatment is high dose of corticosteroids. The long-term immunosuppression, oral prednisolone, not availability of preventive immunotherapy in Africa. Clinical outcome in most cases was not reported. No isolates of cases with relapse. In Sudan, who diagnosed 31 cases, complete improvement in 2 patients, and no improvement in 7 cases. In Senegal, we have the mortality is in 2 patients. After this review, you can say that all regions of Africa were concerned. Publication date varied between 1971 to 22. Clinical syndrome was reported in most studies. Most studies published after 2024, okay, with aquaporin antibodies. Availability of MRI in most sub-African countries. Limitation, not population-wise studies in South Africa. Few cases reported, not availability of aquaporin autoantibodies in most countries, and lack of financial resources. After the investigation, increased availability of MRI. Second, training more neurologists who can diagnose neuroimmunological condition, and subsidizing cost for serum antibodies testing, and increased availability of serum antibodies testing. Creating educational training for non-neurologist healthcare provider to improve timely referrals, developing national guidelines for diagnosis, and creating educational material for public, and creating African collaborating research group for animal disorders. In conclusion, animals are present in South Africa since 1971, but are likely to be underdiagnosed or misdiagnosed with improper management, the best approach is to continue education, awareness, and collaboration to close the wide gap in animal spectrum disorders cases. It is the best place in Ouagadougou, in Burkina Faso, the capital city. Thank you. By working together.
Thank you very much. Est-ce que vous pouvez faire juste un tout petit
Ok, c'est une étude sur le point sur les études qui ont été réalisées en Afrique subsaharienne sur la neurobiolite optique, qui est une maladie rare, une maladie immunologique rare qui est caractérisée par la neuropathie optique, et l'atteinte d'une myélite, également le syndrome de l'aréna posterior avec des vomissements inversés. Sur le plan de l'épidémiologie, on voit que les cas les plus, la prévalence la plus importante a été retrouvée au Nigeria, tandis que la plus faible prévalence a été retrouvée en Éthiopie. Parmi les signes les plus importants, on a la myélite optique et la neuropathie optique et la myélite. Il existe un gap au niveau du diagnostic positif de la neuromyélite optique, notamment au niveau de l'imagerie médicale, notamment l'IRM qui n'est pas disponible dans tous les pays, et également au niveau du diagnostic biologique avec la componente 4 qui n'est pas disponible. Et quand on regarde, on voit que la componente 4 est disponible dans quelques pays. Et dans certains cas, cet examen peut être fait à l'extérieur, surtout dans certains pays où eux-mêmes ils peuvent disponibiliser, comme au niveau de l'Afrique du Sud. Il y a bien sûr des forces à travers ces études et des faiblesses. On voit qu'au Nigeria, depuis 1971, il semble qu'il n'y a pas d'études sur le plan épidémiologique, alors que beaucoup de cas ont été retrouvés en Afrique de l'Ouest, notamment dans presque tous les pays de l'Afrique de l'Ouest, il y a au moins un cas. Tandis qu'en Afrique centrale, il n'y a pas beaucoup de cas. Donc ça, c'est les forces et les faiblesses. Maintenant, au niveau des recommandations ou suggestions, c'est selon, on peut dire que la première chose, c'est de subventionner le prix des examens complémentaires, notamment l'IRM cérébral et l'IRM médulaire, et favoriser la réalisation biologique de la componente 4 dans tous les pays africains. Également, il faut qu'il y ait une collaboration entre les différents pays, entre les différents neurologues, pour qu'on puisse faire des études épidémiologiques. Parce que quand on regarde les cas, c'est des cas cliniques, des cas qu'on observe souvent, même on ne voit même pas les dates, la période de l'examen. Donc il faut qu'on mette en place un groupe de recherche sur la neurobiolite optique. Merci beaucoup.
Merci. On va tout suivre le docteur. Il y a une question. Docteur, attendez s'il vous plaît. Il y a juste une question.
Il y a une autre question. En anglais approximatif.
Hello, doctor. Thanks a lot. Wonderful. Quick question. Sometimes I get referred transverse myelitis.
Transverse myelitis.
Just from my own knowledge, these two conditions, optic neuritis and transverse myelitis, can they exist independently, or they always go together? And the second question is, if someone has become already lost their vision, I don't know how it works, or already the vision is gone, and they found out that they have the transverse myelitis, is there any chance at all that the vision comes back, or that's it, it's gone, once you've lost your vision? And then the same goes for the transverse myelitis, which was the paralysis of the limbs. If you start the steroids and everything, is there a chance for recovery? Or once it's gone?
C'est les immunoglobulines.
Alors, for the first question, the two clinical characteristics we've developed each level. Yeah, differently. One clinical is if you have one clinical case for meningitis, you can say that you have NMO disorder with the presence of autoantibodies accompanying that. For the treatment of transverse myelitis, most cases you can use the best treatment is immunoglobulin. Immunoglobulin, 1 gram immunoglobulin G. But sometimes, if you are not money, you can use corticosteroid. Yeah. According to vision loss for patients with transverse myelitis, I don't understand.
The question is, if the vision is already gone before the diagnosis, is there a chance that the vision?
No, c'est la perte de la vue, ça c'est définitif. Right.
Thank you very much for your attention.
All good?
Thank you.
Thank you very much.